Thank you so much, everyone, and welcome to the official launch of Healthy People 2020. All right. It's great to see this overflow crowd, and thank you so much for your presence and your support and your leadership. First of all, many thanks to President Knapp and Dean Room and GW. This is an absolutely beautiful facility, and we're just thrilled to have your support and your hospitality as we launch this momentous effort for the next decade. I am truly filled with gratitude to everybody here and to hundreds, if not thousands, around the country for making this day a reality. First, tremendous thanks to our Office of Disease Prevention and Health Promotion, Penny Slade-Sawyer and Carter Blakey, and our staff. Our wonderful leaders at the National Center for Health Statistics, Dr. Ed Sondick and Mr. Richard Klein and their colleagues. To our very energetic colleague, Todd Park, the Chief Technology Officer at Health and Human Services. You'll be meeting Todd and feeling his energy and passion in just a couple minutes. We are very, very grateful to the Secretary's Advisory Committee, led by Drs. Fielding and Komanika. And we've had their expertise for a number of years, and we're very grateful to their leadership. We've enjoyed the support of a tremendous Healthy People 2020 federal interagency work group and the expertise of hundreds of topic area experts who have worked so diligently to make this final product a reality. We have many senior leaders from Health and Human Services, Dr. Josh Sharfstein, Deputy Commissioner of FDA, Dr. Larry Tabak from NIH, Dr. George Askew from ACF, and many, many other leaders. Thank you for your support. I want to recognize our Surgeon General, Dr. Regina Benjamin, and thank her for her presence and her leadership. And a special thank you to former Secretary Richard Schweiker, who is in the audience today. I think he deserves a special round of applause. But most of all, I want to thank all of you, everybody in this room, and our colleagues at over 5,000 sites around the country who are joining us by web streaming and helping us celebrate a truly historic launch. Because today is the culmination of literally years of work from thousands of Americans who care deeply and passionately about making our country healthier. We are joined by colleagues from national, state, and local organizations, from academia, and from diverse communities and neighborhoods across this country. But despite our diversity of backgrounds and experiences, today we stand as one community and one nation to celebrate a unity of purpose that is represented by Healthy People 2020. Over the past 30 years, Healthy People has motivated action, encouraged new directions, and unified commitment for a healthier future. Each decade since 1980, we have mobilized the best public health talent possible to set overarching goals, identify topic areas and targets, and promote the power of prevention. And in this way, Healthy People has become the public health roadmap and compass for the nation. Over the years, our country has made substantial progress in meeting Healthy People targets in areas as diverse as coronary heart disease, stroke, AIDS, cancer, childhood vaccinations, and other conditions. However, health threats still prevent too many Americans from reaching their highest attainable standard of health. And so now Healthy People 2020 presents us a new vision, literally 2020 vision, where every American can live a long and healthy life. We are delighted today not only to build on the proud history of Healthy People, but also offer 6 new aspects for Healthy People 2020. First of all, Healthy People 2020 expands to address 4 main overarching goals: to eliminate preventable disease and premature death, to achieve true health equity and eliminate disparities, to promote healthy development across the life stages, and create social and physical environments that promote good health for all. These latter two new overarching goals reflect our solemn appreciation that our good health is a precious gift and it must be protected every day throughout the lifespan. And the best way to do so is through a broad social determinants approach, that is, an approach that recognizes health in all policies so that the healthy choice is the easy choice. And we understand today, more than ever, that the health of the individual is almost inseparable from the health of the larger community, and the health of every community determines the overall health of the nation. In other words, we are all interdependent, we are all interconnected, and we all have promises to keep. Secondly, Healthy People 2020 represents our most inclusive process ever. We are very grateful for the over 8,000 comments we received about targets and objectives from people across the country, received through public meetings, the internet, and mail. And we're also very grateful for the unprecedented active involvement of other departments in our federal family, such as the Departments of Agriculture, Education, Housing, Transportation, the Veterans Affairs, and the EPA. These are departments that are making health in all policies really come alive. Third, Healthy People 2020 includes the first ever fully public Healthy People Federal Advisory Committee. I am so grateful for the superb leadership of my friends and colleagues, Drs. Jonathan Fielding and Shriki Kumanika, and the many national experts who advised on this committee to make this product a reality. Fourth, of the 42 topic areas in Healthy People 2020, 13 are new, reflecting the ever-expanding scope of public health. Some of these new topic areas address new subjects, such as healthcare-associated infections and public health preparedness. Some re-emphasize the importance of public health throughout the lifespan, with special attention to childhood, adolescents, and older adults. And we're also very pleased to unveil a new topic area focused for lesbian, gay, bisexual, and transgender populations, or LGBT health. Fifth, we are very, very proud to unveil a dazzling new website, healthypeople.gov. This is newly redesigned, interactive. It replaces the traditional print publication, and it makes Healthy People accessible to every American. Today, we unveil version 1.0 with the understanding that Healthy People is a living document and it will change and be updated regularly. And in a couple of minutes, you will hear from my wonderful colleague, Todd Park, who will tell you more about how to make web-based data really come alive in the most exciting way to motivate change in neighborhoods across the United States. Sixth, last, and certainly not least, the launch of Healthy People occurs in the context of the passage of the Affordable Care Act, signed by the President into law March 23rd of this year. As you all know, the Affordable Care Act is an unprecedented opportunity not only to dramatically expand access to care, but also to build true systems of prevention. The Act authorizes coverage for clinical prevention services for many individuals, health promotion opportunities for businesses and states, and furthers public health nationally through a new prevention council and a new prevention fund. Healthy People will serve as a foundation for all these efforts moving forward. So in summary, as I close, we celebrate that Healthy People 2020 captures both legacy and promise for the nation. It represents inspiration and aspiration for every community in the United States. We can work as one nation and indeed as one community to help all people reach their highest attainable standard of health. Thank you for everything you have done to make Healthy People 2020 come alive for all Americans and to bring hope and health to our nation for the next decade and beyond. Thank you very much.